But it's a real honor to be here this afternoon to talk about what we are doing at LSU School of Veterinary Medicine, LSU Vet Med, to support what is an incredible transformative industry in Louisiana. The equine industry is all-pervasive. Can I just take a poll? Can you put up your hand if you've ever either owned, ridden a horse, or been to an equine or equestrian event? Yep, quite a few people are putting up their hands, and you would be in very good company because there are in excess of 40,000 horse owners in this fine state, and the equine industry accounts for an economic impact of, would you believe it, according to the Horse Council, the American Horse Council, of over $3 billion per year. Now, if that wasn't enough, then let me just tell you it impacts the lives of so many people throughout the state, whether it is for horse racing, thoroughbreds, quarterbreds, whether it's for shows, competitions, or simply recreation. And the industry is parsed out such that about 9% of horses are involved in racing, about 14% in sports and competition, and then the rest in recreation. But in terms of economic impact, the proportions are a little bit different in that racing accounts for about 24% or so of overall revenue, and then recreation about 31%, and then show and competitions 41%. The numbers are amazing, and the numbers are growing year by year. We have an obligation in this state to support this economic driver and this source of immense pleasure to folk of all walks of life. It's not just affluent individuals, but all walks of life that benefit from horses and what they deliver in terms of entertainment, in terms of economic drivers, and all of the other positive benefits that come from such a robust industry. The reason that we are very concerned about supporting this incredible industry in the vet school of LSU is because there are a number of challenges facing it. It would be remiss not to mention just some of the challenges, the headwinds, really impeding the equine industry, or at least challenging it on a daily, weekly, and a monthly basis. Number one of which is, of course, animal health and welfare. We are primarily concerned about keeping horses healthy and able to do what they should be doing, whether it's racing, whether it's jumping, hunting, barrel racing, whether it is simply trail riding. We want to keep those horses in Louisiana healthy, and they are challenged with a number of infectious diseases, parasites to which increasing resistance is being shown. They are predisposed to colic. We have a number of experts who are able to operate on those horses, and laminitis, equine metabolic syndrome, a number of diseases are becoming ever more common and ever more likely to impact the health and well-being of horses and their ability to deliver the pleasures that we all very much take for granted. Economics is also bearing down on this industry. It would be remiss of me not to mention that. Whether it's the rising cost, we've all heard it, of foodstuffs, consumables, seed stock, hay, yep, veterinary care too, because we also have to cover our costs. This is challenging the industry. Other things include volatility in breeding mare foals, crops, competition from neighboring states. Texas has a huge horse population, and they provide incentives for horse racing and showing. So that's another really challenge for our state, because horses, we don't want our horses to go to neighboring states for those equestrian events. And then the impact of, yep, you know, natural disasters, hurricanes and flooding. They all bear down on an equine industry that nevertheless is growing and doing rather well. But still, those factors need to be addressed. There's also, and this is one area that we really can make an impact in at the vet school, a workforce crisis looming on the horizon. So at the moment, we have calculated that there are 53 equine-only veterinarians in this fine state looking after a total number of horses of in excess of 110,000. Sometimes it gets to 120,000 and more as horses move into the state for various events. This is a low number right now, but if you fast forward 10 years with demographics of veterinarians who wish to do other things, retire, and enjoy their senior years, and a lack of a pipeline, pathways into that profession because of the challenges of other sectors in the veterinary industry, the veterinary profession, then we're faced with an ever-diminishing number of vets to look after those horses. So in 10 years' time, we estimate that there will be 40 or fewer vets who are focused only on equine if the current trends are continued, which underpins the vital importance of the vet school in supporting pipelines and pathways into that profession. There is a shortage, and we absolutely have to address it, and we have plans to do so. There are also environmental and regulatory challenges to our industry. So whether it's conflicts in land use because of development, encroaching on farms and trails, whether it's water quality, pasture contamination, manure management, whether it's licensing and oversight of racetrack safety, that's a big deal in terms of the safety of the horses and the riders who compete on those racetracks, or whether it's biosecurity for multi-facility events. Just imagine when different horses come from different states to a particular event, the propensity and risks to their health in terms of infectious disease are magnified, and we need to have security measures in place to avoid the impact of those diseases, some of which have zoonotic potential. In other words, some of those diseases can transfer and infect humans and lead to rather nasty outcomes, including, in some cases, fatality. So biosecurity and looking after the health and containment of infectious disease risks in those events is really crucial. So for every challenge in the equine and equestrian industry in Louisiana, we at LSU Vet Med have a solution. We don't like problems, we like ways of solving them. And we have solutions. Right now, we have one of the biggest and most accomplished equine veterinary teams in the world, not just in the US, but in the world. We have experts who can deal with your horse on an emergent basis, so these are specialized in emergency and critical care. We have vets who are on the road doing ambulatory clinics. We have vets who do surgery, whether it's orthopedic or soft tissue. They can do that day or night. We're 24/7, 365, and that's becoming increasingly unlikely and rare. Whether it is internal medicine problems, you name it, we have vets who deal with that, or sports rehabilitation and recovery. We have individuals and experts in those areas too, including the fusion, and this is really unique, of Western and Eastern healthcare systems. So we have experts in, for example, acupuncture. And did you know that you can do acupuncture to great effect on horses? Yep, absolutely you can. And it is complementary to many of the other therapies that we provide. So we have one of the largest teams, and we're able to deliver service to about 1,700 inpatients per year and many hundreds of outpatients on the road going to people's farms. This is great. The people are the most important ingredient of the vet school, and we're so proud to have those individuals because they attract students who want to do equine veterinary medicine. But the reality is our facilities are not where they need to be. And we have a bold vision going forward to build a state-of-the-art Center for Equine Health and Sports Performance. The only thing between us and that vision is a mere $40 million. But we are getting there, and we're boldly embarking on a philanthropic campaign to make this vision happen. And our development team and our assistant dean for outreach and strategic initiatives, Bunny Cannon, and our strategic communications and marketing team are doing an awesome job in showcasing what we do and in promulgating that important message to anybody who has any interest at all, hence me being honored to be addressing you today. So we have the people, and we're able to deliver some pretty awesome services right now, but we can do so much more if we have this vision come to fruition. We'll be able to expand our caseload and accommodate and compensate for that attrition in number of equine vets going forward. We'll be able to train more veterinary students. We've just increased our class size to 200 DVM, Doctor of Veterinary Medicine students per year. And roughly in the old class, which is about 120 strong, about 5 or so would state that they wish to do on graduating just equine practice. That's a very low number, but we can treble that. We estimate to 15 or more if we're able to match the expertise and excellence of our people with facilities, brick and mortar facilities that match. And we are on the way of realizing that dream with the help of all of our colleagues at LSU. But it's not just educating, as important as that is, and that's our raison d'etre. That's why we exist, to educate both veterinary students but also graduate students, master's, PhD, and in addition, we're developing now a school for veterinary technology, veterinary nurses, veterinary technicians that are equally, or in fact more important than veterinarians in delivering that sort of clinical care that we aspire to. And that veterinary technology school will be up and running, we hope, next year, accepting their first cohort of veterinary technology students that will be equally important to the expansion in our DVM class size. They work hand in hand, synergistically. But it's not just educating and delivering excellent clinical care day and night, 365 days a year, but it's also generating the new knowledge that will lead to the new diagnostic tests and treatment modalities that we will rely on as we go forward, whether it's surgical, medical, emergent. We are doing research in all of those areas, in areas such as musculoskeletal mechanics, in areas such as the pathogenesis, the disease mechanisms of colic, abdominal pain in horses, and all of the various reasons for them to have abdominal pain and how to correct them with surgery. In laminitis, a devastating disease representing inflammation of the hoof lamellae. In other diseases, in bleeding guts, in epithelial bleed, for example, which is a cause of lack of performance in some racing horses. We're doing research in that and a whole lot more besides to generate the new knowledge that we will need to deliver excellence going forward in years to come in diagnostic tests and in the sort of treatments that will keep horses in Louisiana safe and well. In addition to that, we are developing new ways of getting into vet school. We're partnering with 4-H and FFA, Future Farmers of America, in developing pipelines into the veterinary school in very talented individuals even before they've entered their undergraduate program. So there have to be some evidence of large animal interest, evidence of GPA requirements, and evidence of continuing service learning throughout their undergraduate degree, but we're able to work with the School of Animal Sciences and LSU Alexandria in developing those pipelines that essentially capture those passionate individuals before they lose that passion and go off into different trajectories. So we have a duty to deliver those pipelines, and we are delivering on them month in, month out. And we've already got a number of students involved in this so-called LEAD V program, LSU Early Admission for Developing Veterinarians. We also do a lot of testing through our world-class American Association of Veterinary Laboratory Diagnosticians accredited diagnostic lab. It's the state veterinary diagnostic lab, now rebranded LSU Diagnostics, still affectionately known by the longer name of Louisiana Animal Disease Diagnostic Lab, but try saying that quickly on the phone in the dead of night. LSU Diagnostics, much easier to say. So we deliver a number of crucial diagnostic tests in horses, whether it's viral encephalitis, whether it's gut worms, whether it is different bacterial diseases like strangles. We have tests to ensure that those horses are monitored and kept healthy throughout their lifespans and throughout their working lives. And we're very proud to interact with a number of strategic stakeholders and partners. We definitely regard these as partners in our mission to safeguard Louisiana's animals, whether they're horses, wild animals, or companion animals. And they, of course, include the Louisiana Racing Commission, the Louisiana Quarter Horse Breeders Association, and any number of the 63 equine associations that exist in Louisiana. We wish to be great partners and great colleagues, and we wish to be as accessible and as approachable and as collaborative as we could possibly be. We're also great partners to the Louisiana Department of Agriculture and Forestry. I hope so, because their commissioner is an alumnus of ours, Commissioner Dr. Mike Strain, and he and I have a great relationship working on such awesome initiatives like the Equine Health Program, Healthy Horses, Healthy State, which was very much his flagship, and he continues to promote equine health. We also are very proud to partner with the Lieutenant Governor, Billy Nungesser, who recognizes the pivotal importance of horses to the tourism industry in Louisiana. And we love the idea of bringing a Breeders' Cup race to Louisiana to showcase all of the excellent horses and great people who breed, train, and race them here in this fine state. So how can you in the media help us? Because everybody has a role to play, and we all want this state to be the best version of itself, growing and becoming recognized for so many things beyond the awesome things that it already develops on a worldwide scale: culture, food, traditions. We want to be known as one of the premier horse states in America. So first of all, obviously raising, which is what we're doing now, raising public awareness of the importance of the equine industry to Louisiana and further afield is pivotal. Obviously, it's an economic driver. It's $3 billion worth of economic impact per year, but it also impacts the lives of people in so many richer ways in terms of their pleasure of life. Whether you like watching racing, whether you want to tipple and do some gambling at a racetrack, whether you like hunting, whether you like trail riding or barrel racing, whatever your passion, horses deliver it, and they are making lives and livelihoods every single day. We would be thrilled if you feature us in some of your news releases in terms of what we're doing at LSU, and we have a distinguished guest, Provost Troy Blanchard, here right now. We act in the ecosystem of LSU, which is an awesome academic institution delivering so much for Louisiana. We're a small piece of that puzzle at the School of Veterinary Medicine, and we do a heck of a lot in terms of delivering for the animals and the people in the state. We do a lot of biomedical research to advance not only animal health, but also human health as well. And I don't think many people knew that. But our new edition, the spring issue of Uproar, our school magazine, which is in your packets, will give you a little bit of an insight as to the breadth and depth of what we do. Not just equine health, medicine, and surgery, as important as that is. We also would love your partnership in messaging disasters and disaster responses, because we at the vet school are able to rescue horses whether they're stranded in a ditch, whether they're in floodwater, or anywhere in between, having had a lot of experience with hurricanes and flooding. So I want to come to a conclusion, because I'd like to give time for questions and answers, hopefully to answer your questions as they come. But I just want to say that it's a pleasure to be at the helm of one of the finest vet schools in the world. I truly believe that. We're growing in all of our missions, whether it's teaching, healing, discovering, or protecting. And horses and supporting the equine industry in Louisiana is absolutely vital to what we do. We truly believe it's one of our areas of distinction. We have a large team of veterinarians and veterinary technicians who love and deal with horses day in, day out, whether it's the middle of the night, Christmas Day, Thanksgiving. We are here, and we're here to support you if you love horses or any other animal besides. So thank you for having me. I'm honored to be here today, and I'd be absolutely thrilled to take any questions. Thank you. I'll repeat it. Yep.
Hi, Dr. Gordon. Piper Hutchinson, Louisiana Illuminator. The legislature appropriated $3.5 million to LSU for the purchase of a equestrian center in Opelousas, with the reason given being that it would be used by the veterinary school. Can you tell me what the school intends to do with the facility?
Well, we have a large vision for a new equine center of excellence. In terms of that specific vision, that's to be determined. So, I mean, we've yet to engage fully on those conversations, but we have a number of potential uses of a facility like that. But right now, we're laser focused on our current people and our current vision for a center on the LSU Vet Med campus, and that is our major focus right now.
So this was not something that the vet school had asked for?
We have currently focused philanthropic efforts on our vision for a center of excellence on our campus, and that's been our main focus currently, correct.
Is that vision that center would actually be on the current property that you own, adjoining your other facilities, or on another LSU?
Thank you very much. So the question is, would the center that we're envisioning be on the current footprint or somewhere else? And it would very much be on the current footprint. We believe it'll be located. I mean, our schematic design, and we've done some detailed review of traffic flows and so on, it will be on the northwestern part of our campus. So it is actually within the footprint of LSU Vet Med as it currently stands. Thankfully, we're in the very fortunate position of having the land to accommodate what would be about 100,000 square feet and a multi-story building that would deliver both clinical care, education, and importantly, research as well.
I have one other question. Is there thought of training the students to have joint specialties of both small animal and large animal?
So the
Fill that void that you're talking about in equine. Plus, those equine people make less money.
Thank you. So the question is, do we have a vision to train both small and large veterinarians that can accommodate all species? And yes, all of our students right now, and this will continue for many years, we've just revised our curriculum, are trained to deal with small and large species, dogs, cats, and horses. They do have, nevertheless, a mechanism for tracking in a species, and some do track in equine, but they still have to fulfill the requirements to be able to deliver veterinary care to small animals. And this is one of the reasons why the equine industry is under challenge, because the salaries, as you rightly said, of equine veterinarians, certainly on day one after graduating, or even 1 or 2 years later, is far below that of vets who deal with dogs and cats. So that is one of the challenges. Another challenge is rural settings, and not just for horses, but for food animals and also small companion animals. So we are absolutely committed to delivering mechanisms to try to inject veterinarians back into those rural areas. Now, there was until recently a scheme to facilitate that, the Veterinary Medicine Loan Forgiveness Program, Loan Repayment Program, but that's delivered by the United States Department of Agriculture, NEFA, but that's been frozen right now, to the best of our knowledge. It hasn't been, there's no evidence of it continuing. Whether it will or not is debatable. But various states are actually delivering their own loan forgiveness programs for veterinarians if they commit. There are 27 states across the nation who are delivering these statewide programs rather than at the federal level to fill the gap. If those graduates will commit to a certain period of time of work within rural counties, it would be wonderful if we had a similar mechanism in Louisiana, but I think it will take those sort of incentives to really have a big impact on rural representation of veterinarians. And this is a global phenomenon, global challenge. Yes?
Did you say that diseases among horses is increasing?
I'm not sure specifically diseases in general, but there are certain diseases that are becoming more prevalent or recognized, like equine metabolic syndrome, for example, that's associated with obesity, insulin resistance, laminitis. So that's being increasingly recognized and recognized as a threat. We are also aware of other diseases that are a threat, thankfully not in Louisiana right now, but for example, and Commissioner Strain made a commentary on this in May, the New World screwworm, so Cochleomia hominovorax, so that is a threat in terms of its encroachment from South America, Mexico. Certainly right now there's a block on the transfer, importing of cattle, bison and horses across that southern border, largely to try and stop this awful problem. It's a fly that essentially, whose maggots, whose larvae feed on decaying, sorry over lunch, but decaying wounds and flesh, and is really a big problem in all mammalian species, but certainly in horses, and that's one thing that is a threat. There are various viral encephalitides that we monitor for, we provide diagnostic tests for in the diagnostic lab. We can pretty much diagnose anything that's prevalent in equine and other species right now. So those are recognized as threats: West Nile virus, eastern and western equine encephalomyelitis, southwestern equine encephalomyelitis as well. So these are threats that are being increasingly recognized. I'm not sure their prevalence is increasing, but they are encroaching in areas as as climate change occurs. Many of them are arboviruses, so they're actually transmitted by mosquitoes, and of course we all know that in the humid south, mosquitoes are abundant. Yes, sir? So the question was, do we inspect and monitor, as I understood it, I'm not hearing you correctly, very clearly, but do you inspect and monitor feed stuff for horses? We don't directly, although we have had occasion to check them for certain diseases like clostridial diseases, and we had an outbreak of such last year that we were able to diagnose through our diagnostic lab. However, we have an excellent College of Agriculture and an ag center that has representation across all 64 parishes, and they do some work on feed stuff and monitoring. And we have a very good collaboration with our colleagues in the College of Agriculture. We do a lot of collaborative work together, but we ourselves at the vet school don't directly, routinely at least, test equine feedstuffs. Who's going? Yes.
Could you tell us vision for this new equine center? Is there another university that maybe has one currently that you would compare this to?
Yes, thank you very much indeed. So the question is, could I articulate a vision for the center? Absolutely. We have carefully considered what it would take, and it would take a building of about 100,000 square feet with multiple different wards, including isolation, including colic, surgery wards, soft tissue, both colic and non-colic. It would include an intensive care unit, an emergency area, an area for reproductive sciences, theriogenology, and underwater treadmills for rehabilitation from orthopedic and sports injuries. Importantly, however, it would also include an imaging suite that would be able to offer wonderful and tailored imaging modalities for horses, like, of course, digital radiography, but CT, MRI, magnetic resonance imaging, and PET spectroscopy, so PET scans that will detect earlier on microfractures and enable us to tell whether it's safe for that horse to race or whether it's likely that that microfracture would become a real, a gross fracture and lead to that horse succumbing to that injury. So it would provide all of those modern medical and surgical facilities. It would provide a wonderful space for teaching with seminar rooms, and on the second floor we envision research labs to enable a very close juxtaposition between new knowledge being translated to diagnostic tests and treatments in the floor below. So that partnership of our researchers and our clinicians, and of course students are front and center of everything we do, is pivotal to that vision. As to whether other institutions have this, absolutely. Absolutely. So Texas A&M has an incredible facility. Colorado State is midway to building a $230 million new clinical facility. Georgia, North Carolina State, Tennessee, Florida, they all have, Florida in fact has two, all have state-of-the-art equine centers and facilities. The median cost of those is about $50 million, so ours at about 40 is we believe, good value for money. But yes, I think in terms of our people, we're absolutely able to compete with the best. Our facilities, we're getting there through aggressive philanthropic outreach.
How is the vet school impacted by the uncertainty of federal research funding right now, and is that going to impact the Center for Excellence that y'all are working on?
So the question was, how is the vet school being impacted by the freezing of federal dollars, in particular the indirect cost, as I understood it, or in general?
The freezing of indirect costs and any potential rescission of grants.
Yeah, so absolutely. All of these executive orders, it would be foolish of me to say that they have no impact. We've had 2 grants that have been rescinded, not in equine research, but nevertheless in important work that we do. And we don't yet know whether the impact on indirect cost, what the impact will be. It depends on where that lands. It is a fact that the cost of research is not even covered by the regular indirect cost recovery. There are so many costs behind the scenes, legitimate costs to support facilities and administrative costs, that we will end up, if it goes to 15%, essentially bankrolling our research. At the moment, we are providing for those, well, we've got one in particular researcher who has had his grant rescinded. We are providing bridge funding to support that spectacular individual. But luckily, at the moment, the impact is limited. But we watch developments with an eagle eye, and we will do what it takes to become as efficient, as streamlined, and as high value for money as we always have been and will always continue to be.
Are you counting on federal funding for the launch of this Center for Excellence, and is that, are there any concerns about that going away?
So the question is, are we counting on federal funding for this particular vision? Right now, we are viewing it as a philanthropic endeavor. Yes.
Go back, there's 2-part question that I talked to you before. In competition, you didn't mention all the universities.
Right, I didn't mention them all, that's right.
They got championships. You know, this past year, I think, what, Texas A&M, Auburn, always. Is there ever going to be a time that LSU, our team, whether horse riders, whatever they jumping and all that, are we going to be involved?
So a very good question. So the question is, are we going to, I suppose, resurrect, re-envision, reinvigorate our equestrian team? And we obviously would love that to be the case. I'm not in a position to answer that. I think it would certainly elevate our perception of LSU as an equestrian hub. And on the veterinary side, we absolutely want to be champions. And what I can speak about is what we're delivering for veterinary care throughout the state and nation. In that regard, we're champions and then some.
You also mentioned that your outreach program. I want to make sure I get that recorded and everything. I got confused because it's now by LSU, but the horse training center or it's a Brack Park. I was thinking LSU had a lot to do with it. But every year they have 2 of the days where they're learning, they do with physically challenged kids. Every year we used to advertise to go there. I haven't seen it last 2 years.
Well, so certainly what I can speak about is the outreach and community engagement we do at the vet school. We have thousands, I'm talking 10,000 plus visitors to the vet school every year. About 6,000 of those come on open day, but we literally invite with open arms children, high schoolers, adults, stakeholders, members of the community. We have numerous ways of engaging. We absolutely love it. So we'll take, for example, the other evening we had a Rotary off-site event. We had about 150 Rotarians visit. We will engage with school children. Ginger Gutner, our Assistant Director of Communications, will often do school tours around the main campus, but also Mike the Tiger outside the enclosure to talk to them about biomedical science, conservation, veterinary medicine. We have had in the past legislators to indicate to them what incredible value for money the state appropriations coming to the vet school is. We deliver about $6 back into the community for every dollar of appropriation that we get. Our economic impact right now per year is about $220 million. When we get to 4 years of 200 DVM students, it will escalate up to about $330 million per year, just from the vet school alone. That's not even counting our graduate student programs and others. So we're delighted to partner with community members. We take community engagement very seriously indeed, and we'd be thrilled to invite more people in. It's what we do.
I got confused. I was Brett was doing it, but I thought LSU was involved.
Absolutely, and we do things in partnership with them as well. Yeah, absolutely. Thank you. Yes?
Would you be willing to comment on the use of ivermectin in humans?
Yeah, so the question was, would I be willing to comment about the use of ivermectin in humans? Absolutely. It has specific licensed uses when human ivermectin products are used. Equine products are dangerous to be taken by people, and the disinformation about the value of it in certain disease states is unfortunately leading to people thinking that they're going to cure any number of diseases by taking some horse medicines. This is a very dangerous thing to do. It has a known plethora of adverse effects if given in overdose, and if you're taking horse medication, you're going to overdose yourself, including neurological deficits and seizures, etc. So it has its uses if the right products are used, but please don't take horse ivermectin. Yeah.
I think, John, did you have a question? Last question. Okay, John.
You mentioned a number of organizations you work with. Is there a particular organization that pretty much serves as the trade association for the industry?
So is there an organization that serves as the trade association? Well, we partner closely with the Racing Commission and with the Quarter Horse Breeders Association, but about to be signed is a bill that will become an act to form a Louisiana Equestrian Corporation, and I'm very eager to see what that will lead. 2 of the members of that board will be representatives from higher education, and we very much hope that we'll have a place at that table at LSU Vet Med.
Thank you.
Thank you very much.
Thank you so much.
Thank you.